We're broadcasting live from Dora Nginza Hospital, where the Premier of the Eastern Cape, Mr. Oscar Mabuyane, did a walkabout to find out, since the visit of the Minister 3 weeks ago, who was asking and pleading for change in terms of more ventilators, more staff, more monitors, has that been done at this hospital? So he joins us now to find out exactly, is he impressed with the work being done by the workers here? Mr. Premier, you were here early morning visiting Dora Nginza Hospital, which has been in the media for all the wrong reasons. Are you happy with what you've seen at the hospital this morning?
Yes, of course, a lot of progress that has been made. The system is stabilized and a lot of effort that is being actually put into the system by managers, employees. We really appreciate the work that is being done here. We are seeing commitment now even from workers. And we've seen a lot. Early in the morning, I was in Uitenhage Provincial Hospital, where I saw also a lot of work that is being done. Issues that used to be a problem, teething problems are being resolved every day. We have introduced our hub and spoke service delivery model. It seems to be working as part of the PMU intervention. So we're quite happy with the kind of work and the commitment that we see, the dedication from workers. We are really indebted to our workers, the frontline workers, with all what they are doing, the kind of sacrifice they are making. But in the process, we remember all of us were susceptible as well. They are also contracting the virus. We are here to protect them. We want to protect them. That's why we have said managers must manage, get everything that workers want, so that workers can focus on actually nursing our patients. So there's a lot of work that is being done, a lot of progress. People are being discharged. Those who are actually admitted here because of COVID, oxygen is there. High care do have ventilators. So work is being done. So it seems we are really coping well with the challenges that we are having, and we're seeing also numbers that are being a little bit sluggish. And we know we've been always talking about peak that we're still to confront. We don't want to get excited about all what we see. We are still redoubling our effort to ensure that we prevent any kind of calamity around this particular issue. It's a very difficult virus to manage. We have seen it has collapsed the world. We have said it before, we are not perfect. No one is perfect in the world, but we are perfecting the system every day. We are learning through our mistake. We've been on that learning curve. We basically resolving issues. So the rapid response team, the turnaround time to ensure that all critical and necessary apparatus in our hospitals are there so that everyone is focused. So we don't want people to be negligent. We don't want nurses, we don't want doctors to say, no, we're used to it. Yes, we want to coexist with it, and people must get used to it. But we seem to be seeing a lot of impact that is made by masks. The wearing of masks, we think that they are contributing a lot if we look at how things are happening in terms of our stats out there. So, but we need a research on that. So we say things based on empirical evidence. But we want people to wear masks so that they protect themselves, protect those that are close to, but people must remain at home.
Sorry, Premier. One of the issues at this hospital, the issue of oxygen supply, one of the issues at the hospitals was oxygen supply at Dora Nginza Hospital. How far are you in terms of that?
That has been attended to. That has been sorted. The bulk oxygen, the banks are being sorted out. There's no issue about oxygen here anymore. You remember the issues of that were arising out of maternity ward with the backlog of more than 36 people on the queue. That has been sorted out. We don't want to lose any children here in this particular hospital. So the oxygen issues are being sorted and they are being resolved every day. So there can't be an issue about oxygen anymore. We've actually developed a clear plan with our manufacturer or our supplier on oxygen. That issue, we have said it must be made available to almost all our hospitals, from tertiary down to district hospital, as well as our clinics, because it looks like oxygen is a really decisive kind of intervention that you need. Many people who are suffering through this, they need oxygen. So the more you make it available, the better to really mitigate the challenge of these disastrous effects of this COVID-19.
Premier, the Minister also complained about a shortage of staff, especially in terms of CEO managers. How far are you with that process as well?
That is being sorted out. I think there's a lot of process. There's an improvement on our recruitment strategy that has been developed through the project management unit. So all those issues are being sorted, and we've sorted the issues of getting people to act, competent people in our hospitals where we've been having challenges. The department is actually fast-tracking the permanent appointment of COOs where there are no permanent appointments. But it's not that there are vacancies in a literal sense of word. If there's someone acting, that person is competent enough to lead. that person is a CEO at that particular moment. So we'd want people to do and to really use the opportunity that they are given to the best of their ability. But we are handling the situations, we are resolving problems, the system is normalizing.
Last Premier, the Deputy Public Protector is also here to do an oversight visit. Are you going to work with them to find out exactly what challenges they pick up from the public and try to resolve them with the Deputy Protector?
No, definitely. Chapter 9 institutions are part of this constitutional democracy, and we don't have a choice. When they want to pick up issues, government must actually be accountable for that. The constitutional democracy actually really forces us to understand and appreciate the question of responsibility, transparency and accountability. So whoever comes here doing, whether it's the legislature doing an oversight, we the executive, we must account for that. That's why we want the entire ecosystem to function normally, and we are basically recalibrating every part of our system to ensure that it responds. So any Chapter 9 public protector, whoever who comes, that person will be given answers when the person wants an answer.
That was the Premier of the Eastern Cape, Mr. Oscar Mabuyane, saying that he is pretty impressed with the work that's been done at Dora Nginza Hospital. You remember that 3 weeks ago the Minister of Health was here and he raised some concerns. One, issues of poor oxygen, poor ventilators and also shortage of staff. The Premier has now answered that, saying that they are in the process of making sure they get permanent CEOs. There is an acting CEO lives in the hospital and they've said in 3 months' time they'll make that post permanent. They're also in the process of recruiting more doctors and more nurses, because with the fight against this pandemic, it must be as many nurses and doctors on hands on deck to fight this pandemic. He also said he is aware that the Deputy Public Protector is in the province and in the metro to see an oversight of how hospitals are running, what are the concerns, where are we lacking resources and what can be done to address that. And he says that if any minister or if any public protector does come to the province, he will make sure that he works with them to find out exactly what do they pick up from their investigation in the bid to make sure that above all the citizens who are the ones utilizing these hospitals are assisted as well. So he says overall he is happy with the progress being done here. He says a maternity ward, which was a disaster 3 or 4 weeks ago, the issues there have been sorted out. Above all, he says there is enough oxygen in this hospital that there won't be any more issues of people having to go 24 hours without oxygen supply to their systems. So he says overall he's happy that people now are now committed, doctors are committed, nurses are committed, CEOs are committed to make sure that everyone joins hands to make sure they fight this pandemic, to decrease the number of people being infected in this metro. But for now, let's go back to you in studio.